So Perth's now due to come out of lockdown, surprise, surprise, tonight. Another panicked, unnecessary lockdown proven to be exactly that. Once more, an authoritarian premier too scared to trust the competence of his public health system, a premier who's learned nothing in 15 months of pandemic, locks down his people for 3 days, creates enormous pain and hardship for nothing. Let me be clear, for nothing. And he claims victory.
I can confirm that WA has recorded no new cases of COVID-19 overnight. This is a fantastic result. It shows an immediate lockdown has delivered the results that we needed. The short 3-day lockdown has done the job it was designed to do.
Just nonsense. Forget the science, forget experience, forget the facts. This bloke says go with his feels. He reckons he saved West Australians. And he makes that ridiculous claim less than 3 days into a lockdown for a disease that can incubate for 14 days. This is post-truth politics. This is science-free public health management. And this bloke dares to criticise other governments. The medical experts, the best epidemiologists in this country, you've heard them on this program, they've told us this was the same with the other recent lockdowns too. South Australia in November, Melbourne in February, Brisbane already twice this year, and Perth earlier this year as well. We know those lockdowns didn't do anything except harm because no infection occurred outside the known contacts. In other words, no infection occurred except among those contacts who would have been in isolation already, lockdown or not. It's that obvious, that logical. Unless the disease went beyond those contacts who were already isolated, then clearly the lockdown was unnecessary, superfluous, counterproductive, panicked and wrong. What a joke. Instead of admitting their error, the politicians tell you that black is white, war is peace, that their lockdowns worked. McGowan claims a brilliant success. He can call a lockdown any day he likes now on the basis of 1 or 2 infections and then claim that he's saved the state yet again. Why not lock down Perth forever and he can claim that he's keeping everyone safe every day? He'll cut down on housebreaks for starters. It's just a farce. And he's still going to leave tough restrictions in place. Kids have to wear masks. Kids who don't get sick from COVID will wear masks that don't prevent them from getting COVID to stop the spread of a disease that's not even in their midst at the moment. And now we're getting this pathetic confected debate about hotel quarantine over 1 or 2 cases, as if the reasonable aim here is to have perfection, 100% effectiveness. COVID-19, as we all know, is highly contagious. Now and then there's going to be infections. It's not Ebola. Hardly anyone has been sick in all of Australia all of this year. So the aim is not some fanciful plan of national isolation and elimination. The plan has got to be decent public health management like they do in New South Wales, where they process 2/3 of all the Australians coming back into this country, where there have been outbreaks, but where there's not been any stupid, heavy-handed and heartless lockdowns.
Well, I've said from the outset it's really important for all states to really pull their weight. I'd be very disappointed if because of an incident a Premier decided they didn't want to take as many people home, welcome as many people home, because it does then put extra pressure on New South Wales. But look, these incidents are going to happen. We deal with it.
Look, how these other clowns can see what New South Wales does, see how Gladys Berejiklian behaves with calm and with confidence and competence and also with pragmatism, how they can watch that and not be embarrassed by their own hysteria and incompetence is beyond me. And another thing, the way some people want to ban people coming here from India now is disgraceful. There are Australians in India, thousands of them, and they have a right to come home. What sort of a country would make that harder for them? The whole point of quarantine is to treat everyone coming back as if they're infected. I've done it. It's not fun, but clearly it works. It shouldn't be necessary soon once the vulnerable are vaccinated in this country. But the idea we should now discriminate against people coming here from India is disgusting. It's paranoid. They never did that for people from the US or the UK when their infection rates were 3 or 4 times higher than India's is now. So why India? Imagine seeing what's happening in India now and telling your fellow Aussies who are there that they can't come home, that they have to stay there and add to that country's woes. That sort of response would be, dare I say it, un-Australian. Let's cross to Perth now and catch up with Dr. Andrew Miller, who's the president of the Australian Medical Association in Western Australia. Thanks for joining us again, Andrew. There's a debate about quarantine. Let's put that to one side for a second. How can we have a situation as we have in Western Australia, and we've had it in Queensland as well, where premiers are prepared to lock down millions of people based on one or two cases, when the data shows that this has been superfluous?
Well, I think that the people love it, Chris. There is suffering that's caused as a result of it. You're quite right, but it's pretty hard to persuade a government otherwise when their popularity is built on it. And
hang on. This is not about popularity. We're not talking about a popularity contest here. We're talking about public health management and locking down millions of people based on single infections, and in this case in Perth, 2 infections.
Yes, you're absolutely right. But we recently did have a popularity poll and put these people back in charge because that's what the government's been doing. So I don't think it's going to change anytime soon. What we do need to change is the need for it in the first place, the leakage from quarantine.
Andrew, the point here, though, is we want a medical opinion here. We can all see the politics of this, and we know what's happened with the popularity of some of these tough measures by premiers. But in a public health situation where you have 1 or 2 infections and you know the source of the infection from hotel quarantine and you can isolate the close contacts, what public health justification is there for putting millions of people in lockdown, stopping people from going to elective surgery, preventing people from going to their normal medical appointments, and all the other social and societal problems that flow from that?
Well, what I would like to see is that public health advice released and understand why there is this distinction between different states doing different things, because I don't know how much of this is actually decided by the epidemiologists and the public health physicians and how much of it then gets interpreted through the political process. And it would be fascinating to see that. And I think in a democracy, we have the right to that degree of transparency, and that people ask questions around the arbitrary differences in restrictions. Why is it okay to have 20 people in a restaurant this week, but you can't go and have your hip replaced this week? Those are puzzling questions for people, and I think it would be really interesting to see the basis of the medical advice behind it, which they say there is, but it's not released so that we can go through it and understand. And I think it's important to answer some of the questions that you're asking here, even if we do end up coming to different conclusions in different jurisdictions, which is democracy after all.
Yeah, Andrew, that's a very good point. But also on that, then from a medical point of view, how can Mark McGowan claim that his 3-day lockdown worked when we're not even 3 days into it, and the incubation period for coronavirus or COVID-19 is up to 14 days?
Well, I would say he can't say that the 3-day lockdowns had any effect at all on the test results that we're reporting at the moment, because, of course, they're all from infections from a little while ago, as you point out. He may be referring to giving the contact tracers time to catch up with people before they have a wider net to grasp, and maybe that's his internal assessment of his own contact tracing. But I actually rate them in WA. I think having met them and been briefed by them, I'm sure that our contact tracers are capable of much greater numbers than we've been looking at this week. So perhaps it is gilding the lily to claim any sort of alteration in the course of the disease at this stage from a 3-day lockdown so far.
All right, thanks so much for joining us, Andrew. I appreciate it.
Great to be here, Chris.
Dr. Andrew Miller there, who's the president of the Australian Medical Association in Western Australia.